Hello, and thank you so much for joining me today for the Medicare coverage of skilled therapy presentation. This is brought to you by the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B. My name is Melissa Devine. Let's go ahead and get started. Today we're going to discuss who the Medicare Medicaid Assistance Program is and what we do, what skilled therapy is, and what Medicare's coverage of that skilled therapy is. MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, the MAP program is called the SHIP program, or the State Health Insurance Program. They are comprised of unbiased counselors located all across Michigan with free health benefit counseling assistance. A MAP counselor can help you understand new healthcare options, understand Medicare and Medicaid, compare or enroll in Medicare prescription drug coverage, review Medicare supplemental insurance needs, understand Medicare health plans, apply for Medicaid or a Medicare savings program, and identify and report Medicare and Medicaid fraud and scams. Medicare is health insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and enrollment takes place through Social Security Administration for most, and the Railroad Retirement Board for railroad retirees. Medicare has four parts. Part A, hospital insurance. Part B, medical insurance. Part C, Medicare Advantage, which is HMOs and PPOs. And Part D, Medicare prescription drug coverage. Skilled therapy is services that are reasonable and necessary to treat illness or injury performed by or under supervision of a licensed therapist. There are three main types of skilled therapy covered by Medicare. The first is physical therapy, which is exercise and physical activities used to condition muscles and improve levels of activity. It is helpful for those with an illness, injury, or disability that limits their physical function. Physical therapy will help you regain movement and strength in the body area. Second is speech and language pathology. This is a therapeutic treatment of speech impairments such as lisping and stuttering, or speech difficulties that result from illness. Speech and language pathology will help you regain and strengthen speech and language skills. And last is occupational therapy. This is a type of therapy using meaningful activities of daily living to assist people who have difficulty acquiring or performing meaningful activities due to impairment or limitation of physical or mental function. Occupational therapy helps you regain the ability to do usual daily activities by yourself, such as putting on clothes. Outpatient skilled therapy services are services that you receive when you were not formally admitted to a hospital or skilled nursing facility. You're eligible for Medicare coverage for outpatient therapy services if you need the skilled therapy services and the services are considered safe and effective treatment for you. Medicare defines skilled care as care that must be performed by a licensed professional or under their supervision. Your doctor or therapist must create a plan of care before you start receiving your services, and your doctor or therapist will regularly review the plan of care and make changes as needed. If you meet Medicare's eligibility requirements, Medicare will cover the therapy on a temporary basis to improve or restore your ability to function, or on an ongoing basis to prevent you from getting worse. Medicare Part B should cover your outpatient therapy regardless of whether your condition is temporary or chronic. Medicare Part B will cover outpatient therapy services in a doctor's office, an outpatient hospital setting, a rehabilitation agency, a comprehensive outpatient rehabilitation facility or CORF, therapy clinic, or a public health agency. You can also receive Part B covered outpatient therapy services in a skilled nursing facility if you are there as an outpatient or are a nursing facility resident who is otherwise ineligible for a Medicare Part A covered skilled nursing facility stay. Original Medicare covers outpatient therapy at 80% of the Medicare approved amount. When you receive services from a participating provider, you pay a 20% coinsurance after you've met your Part B deductible. If you are in a Medicare Advantage plan, your costs may differ, so you should contact your plan directly to find out what your estimated costs may be. Medicare Part A will cover skilled therapy when it is received as an inpatient, formally admitted to a rehabilitation hospital, acute care hospital, skilled nursing facility, or under the home health care benefit if you had an inpatient hospital stay. Rehabilitation hospitals are specialty hospitals or parts of acute care hospitals that offer intensive inpatient rehabilitation therapy. You may need inpatient care in a rehabilitation hospital if you are recovering from a serious illness, surgery, or injury and require a high level of specialized care that generally cannot be provided in another setting, such as home or in a skilled nursing facility. Examples of common conditions that may qualify you for care in a rehabilitation hospital include stroke, spinal cord injury, and brain injury. You may not qualify for care if, as an example, you're recovering from a hip or a knee replacement and have no other complicating condition. Medicare-covered services offered by rehabilitation hospitals include medical care and rehabilitation nursing, physical and occupational therapy and speech-language pathology, social worker assistance, psychological services, and orthotic and prosthetic services. To qualify for a Medicare-covered stay in a rehabilitation hospital, your doctor must state that this care is medically necessary, meaning that you require all of the following services to ensure safe and effective treatment. 24-hour access to a doctor, meaning you require frequent, direct doctor involvement at least every 2 to 3 days. 24-hour access to a registered nurse with specialized training or experience in rehabilitation. Intensive therapy, which generally means at least 3 hours of therapy per day, but exceptions can be made on a case-by-case basis. You may still qualify if you're not healthy enough to withstand 3 hours of therapy per day. And a coordinated team of providers, including at minimum a doctor, a rehabilitation nurse, and a therapist. Your doctor must also expect that your condition will improve enough to allow you to function more independently after a rehabilitation hospital stay. For example, therapy may help you regain the ability to eat, bathe, and or dress on your own, live at home, and or live with family rather than in assisted living or a nursing facility. If you qualify for Medicare-covered care in a rehabilitation hospital, your out-of-pocket costs will be the same as for any other inpatient hospital stay. You'll have to meet your deductible period, each benefit period, and there will be no coinsurance for days 1 through 60 as an inpatient, with daily coinsurances for days 61 to 90, and a daily coinsurance for the 60 lifetime reserve days. Keep in mind, if you enter a rehabilitation hospital after being an inpatient at a different facility, you will still be in the same benefit period. If you do not qualify for Medicare covered stay as an inpatient rehabilitation hospital, you may qualify for rehabilitation care from a skilled nursing facility, a home health agency, or an outpatient setting. Skilled nursing facility care is a post-hospital care provided at a skilled nursing facility. Skilled nursing care includes services such as administration of medications, tube feedings, and wound care. Keep in mind that skilled nursing facilities can be a part of nursing homes or hospitals. During a Medicare-covered skilled nursing facility stay, Part A will cover a semi-private room and meals, skilled nursing care provided by nursing staff, therapy including physical therapy, speech therapy, and occupational therapy, medical social services and dietary counseling, medications, medical equipment and supplies, ambulance transportation to the nearest provider of needed services when other modes of transportation would endanger your health. In each benefit period, Part A will cover the full cost of your first 20 days in a skilled nursing facility. For days 21 to 100, Part A will cover part of the cost, and you will owe a daily insurance. Benefit periods measure your use of inpatient hospital and skilled nursing facility services. And a benefit period begins the day you're admitted to a hospital as an inpatient or to a skilled nursing facility, and ends the day that you've been out of the hospital or skilled nursing facility for 60 days in a row. Medicare Part A may cover your skilled nursing facility care if you were formally admitted as an inpatient to a hospital for at least 3 consecutive days. You enter a Medicare certified skilled nursing facility within 30 days of leaving the hospital and receive care for a condition for which you were treated during your hospital stay. And you need skilled nursing care 7 days per week or skilled therapy services at least 5 days per week. If you meet all of the above requirements, Medicare should cover the skilled nursing facility care that you need to improve your condition, maintain your ability to function, or prevent your health from getting worse. Speak to your doctor or hospital discharge planner if you need help finding a skilled nursing facility that meets your needs. Ask them to find Medicare-certified skilled nursing facilities in your area that will address your medical needs. If you're in a Medicare Advantage plan, contact your plan to find out which skilled nursing facilities are in their network. Home health care includes a wide range of health and social services delivered in your home to treat illness or injury. Services covered by Medicare's home health benefit include intermittent skilled nursing care, skilled therapy, and care provided by a home health aide. Depending on the circumstances, home health care will be covered by either Part A or Part B. Medicare covers your home health care if you are homebound, meaning it is extremely difficult for you to leave your home and you need help doing so. You need skilled nursing services on an intermittent basis and/or skilled therapy. And intermittent means that you need care at least once every 60 days and at most once a day for up to 3 weeks. This period can be longer if you need more care, but your care needs must be predictable and finite. Medicare defines skilled care as care that must be performed by a skilled professional or under their supervision. Skilled therapy services refer to physical, speech, and occupational therapy. You must have a face-to-face meeting with your doctor within 90 days before you start home health care, or the 30 days after the first day you receive the care. This can be an office visit, hospital visit, or, in certain circumstances, a face-to-face visit facilitated by technology, such as telehealth or video conferencing. Your doctor should sign a home health certification confirming that you are homebound and need intermittent skilled nursing care, physical therapy, or speech-language pathology services. The certification must also state that your doctor has approved a plan of care for you and that the face-to-face meeting requirement was met. Your doctor should review and certify your home health plan every 60 days. A face-to-face meeting is not required for recertification, and you must receive care from a Medicare-certified home health agency, You cannot qualify for Medicare home health coverage if you only need occupational therapy. However, if you qualify for home health care on another basis, you can also get occupational therapy. And when your other home health needs end, you can continue receiving Medicare covered occupational therapy under the home health benefit if you need it. If you meet all the requirements, Medicare should pay for your skilled care in your home and/or home health aid services. If you've had a 3-day inpatient hospital stay and you meet the above requirements, Medicare Part A may cover your home health care services, including skilled therapy services. If you have not had a 3-day inpatient hospital stay and meet the above requirements, Medicare Part B may cover your home health care services, including skilled therapy services. Now, if you're receiving skilled therapy care from a hospital, skilled nursing facility, comprehensive outpatient rehabilitation facility, also known as a CORF, or a home health agency, and are told that Medicare will no longer pay for your care, meaning that you're going to be discharged, you have the right to a fast, expedited appeal if you don't believe that your care should end. There are separate processes for hospital and non-hospital appeals, but you can file an appeal to extend your care if you feel that continued care is medically necessary. If you're in an inpatient hospital setting as an inpatient, you should receive a notice titled Important Message from Medicare within 2 days of being admitted. This notice explains your patient rights and you'll be asked to sign it. If your inpatient hospital stay lasts 3 days or longer, you should receive another copy of the same notice before you leave the hospital. This notice should arrive up to 2 days and no later than 4 hours before you are discharged. If the hospital says that you must leave and you disagree, follow the instructions on the important message from Medicare to file an expedited appeal to the Quality Improvement Organization, or QIO. You must appeal by midnight of the day of your discharge, and the QIO should call you with its decision within 24 hours of receiving all the information it needs. If you're appealing to the QIO, the hospital must send you a detailed notice of discharge. This notice explains in writing why your hospital care is ending and lists any Medicare coverage rules related to your case. The QIO will request copies of your medical records from the hospital, and it can be helpful to ask for the hospital for a copy of your own. The QIO will usually call you to get your opinion on the discharge, but you can also send a written statement. If your appeal to the QIO is unsuccessful, you will not be held responsible for the cost for the 24-hour period while you waited for the QIO to make a decision. If you remain in the hospital after that period, you may be responsible for the cost of your care if you do not win at a higher level of appeal. If you leave the hospital or miss the deadline to file an expedited appeal to the QIO, you have 30 days from the original discharge date to request a QIO review. The QIO will send a written decision letter once it receives all the information it needs from you and the hospital. If your appeal is denied by the QIO, you can then file an appeal with the Qualified Independent Contractor, or QIC. You have until noon the day following the QIO's denial to file this appeal with the QIC. The QIC should make a decision within 72 hours. If you continue to stay in the hospital, you cannot be billed until the QIC makes its decision. However, if you lose your appeal, you will be responsible for all costs, including costs incurred during the 72 hours that the QIC deliberates. If you left the hospital or missed the deadline to appeal, you can follow the standard appeal process that gives you up to 180 days to file an appeal with the QIC. The QIC should make a decision within 60 days. If the appeal from the QIC is denied and your care is worth at least $180 in 2021, you can choose to appeal the next highest level, which is with the Office of Medicare Hearings and Appeals, or OMHA. Do this within 60 days of the date on your QIC denial letter. If you decide to appeal to the OMHA level, you may want to contact a lawyer or legal services just to help you with this or later steps in your appeal, although it is not required. OMHA should make a decision within 90 days. And if your appeal to the OMHA is unsuccessful, you can then choose to appeal to the Medicare Appeals Council. This is the fourth level of appeal, and you must act within 60 days of the date on your OMHA level denial letter. There is no deadline for the council to make its decision. And if your appeal to the council is successful, your care will then be covered. If the council appeal is denied, you will then need to file an appeal with the federal district court. Now, if your care is ending at a skilled nursing facility, a CORF, hospice, or home health agency, because your provider believes that Medicare will not continue to pay for it, you should receive a notice of Medicare non-coverage. You should get this notice no later than 2 days before your care is set to end. If you receive home health care, you should receive the notice on your second to last care visit. Remember that Medicare covers up to 100 days of care in a skilled nursing facility each benefit period. And if you've reached the limit in your care and do not qualify for it, then you will not receive this notice and you cannot appeal. If you feel that your care should continue, follow the instructions on the notice of Medicare non-coverage to file an expedited appeal with the QIO or Quality Improvement Organization. This needs to be done by noon the day before your care is set to end. They'll make their decision no later than 2 days after your care was set to end, and the provider cannot bill you before the QIO makes its decision. Once you file the appeal, your provider should give you a detailed explanation of non-coverage. This notice explains in writing why your care is ending and lists any Medicare coverage rules related to your case. The QIO will usually call you to get your opinion, but you can also send a written statement. If you receive home health or CORF care, you must get a written statement from a physician who confirms that your care should continue. And if you miss the deadline for the expedited QIO review, you will have up to 60 days to file a standard appeal with the QIO. If you are still receiving care, the QIO should make its decision as soon as possible after receiving your request. If you're no longer receiving care, the QIO must make a decision within 30 days. If the QIO appeal is successful, you should continue to receive Medicare-covered care, and your doctor must continue to certify it. However, if your QIO is denied, you can then file an appeal with the next level by appealing to a qualified independent contractor, or QIC, by noon the day following the QIO's decision. The QIC should make a decision within 72 hours. Your provider cannot bill you for continuing care until the QIC makes a decision. However, if you lose your appeal, you will be responsible for all costs, including the cost incurred during the 72 hours the QIC deliberated. If you miss the QIC deadline and continue to pay for care after Medicare coverage ended, you will have up to 180 days to file a standard appeal with the QIC. The QIC should make a decision within 60 days. If you need to continue further, you can make an appeal to the Office of Medicare Hearings and Appeals, or OMHA. You will need to do this within 60 days of the date on your QIC denial letter. If you decide to appeal to the OMHA level, you may want to contact a lawyer or legal services organization to help you with this or later steps in your appeal, although it is not required. The OMHA should make a decision within 90 days. If your OMHA appeal is unsuccessful and your doctor continues to certify, your appeal you can then appeal to the Medicare Appeal Council within 60 days of the date on your OMHA level denial letter. There's no time frame for the council to make a decision. You have the rights if your skilled nursing facility or home health agency decides to reduce your care because it believes that Medicare will no longer cover it. Be aware that the process is slightly different depending on whether you have original Medicare or a Medicare Advantage plan. If you have original Medicare and your skilled nursing facility or home health care agency decides to reduce services prescribed by your doctor because it believes that Medicare will no longer cover these services, they should give you an advance beneficiary notice explaining why the services are being reduced. If you're in a skilled nursing facility, you should receive a notice indicating that Medicare may deny part of your care. This notice is often called a skilled nursing facility advanced beneficiary notice. If you're receiving care from a health agency, you should have a home health advanced beneficiary notice. Each notice will ask you to choose one of the following three options. You can request care and ask that the skilled nursing facility or home health agency is going to bill Medicare, which is called a demand bill. If Medicare denies the coverage, you have the right to file an appeal. If your appeal is unsuccessful, you may be responsible for the cost of care. And a skilled nursing facility or home health agency may refuse to demand bill. You can also request care and agree to pay for the care out of pocket, or turn down the care and look for another skilled nursing facility or home health agency that thinks that Medicare might cover the needed care. Remember that you have the right to a demand bill if your care is being reduced because your skilled nursing facility or home health agency doesn't believe Medicare will cover it. Be aware that demand billing rules are slightly different depending on the kind of care that you're receiving. If you ask a skilled nursing facility to demand bill Medicare, you cannot be billed until Medicare makes a coverage decision. However, if you ask a health agency to demand bill Medicare, the home health agency may bill you for home health services while Medicare makes its decision. If you're receiving home health care, there are situations when you may receive a home health care advanced beneficiary notice, but do not have the right to request a demand bill. For example, if your doctor reduces the amount of care in your plan, in this case, you would need to get your doctor to change their mind in order to get the doctor to certify you and that you need to have the continued care at the same amount or services and go without those services for the time being. If the home health agency reduces your care for staffing reasons, or they do not think it is safe for you to stay at home, you will need to find another home health agency to get home health care and investigate other care options in your community or go without the services. If you're in a Medicare Advantage plan and your skilled nursing facility or home health agency is reducing your home health care services because it believes that Medicare will no longer cover these services, you typically have to appeal to ask your plan for a fast, expedited review of their decision. Medicare covers skilled nursing facility, home health, and outpatient therapy care, regardless of whether your condition is temporary or chronic, or whether your condition is improving or not, if the care is medically necessary for another reason. Medicare is determining coverage of claims that require skilled care, such as skilled therapy, and they're going to cover services that are needed to help maintain ability to function, regain or improve your function, and prevent or slow the worsening of your condition. MAP is here to help. If you want to speak with a counselor about your specific situation or need more information, give us a call. We're currently counseling over the phone and through Zoom, but our services are confidential and unbiased, and no question is too trivial. We often deal with the very complicated questions as well. For more information, you can access the Medicare and You Handbook, which is mailed to each household with Medicare yearly in the fall. There's also access to Medicare through their website, medicare.gov, contacting 1-800-MEDICARE, or giving MAP a call for your most current and up-to-date Medicare Medicaid information. We really look forward to assisting you. Thank you so much.